Dr. VEER to talk about microscopes, biomes, and machines. We'll probably take a few questions at the end if we have time.
Good morning, everyone. So thanks, Madan and Nishat, for having me here. So I come from one of the oldest surgical retina centers of Punjab. So when Nishat asked me to do this topic, I was more than happy because I've seen from the worst to the best, from the cheapest to the most expensive. So I'll try to give a very unbiased opinion about what you can do in your OR when it comes to setting up a new practice for a new person. So first thing, coming to the microscopes. So I think if you're planning a pure retina practice, the basic requirements that you need is an XY coupling, a continuous zoom, and a side scope for your assistants and your fellows to learn. So these are the three basic requirements that you need for a VEER microscope. So of course, when it's a new person, you're looking at budget options. So you can go for either a Leica M620 or an OMS 800 basic. Zeiss has options like the 300 and the Lumera I if you're looking for a slightly extended budget. And of course, you have advanced options as well, from a Lumera T to the Lumera 700, in which everything is automatic with the biome systems and everything. Leica comes with the options of an 822, 844 and the high-end Provio 8. Hark Street also has an option, Neo 900. Alcon has its microscopes, which are the Luxor LX3 and the newly launched Revelia. I personally have the OMS 800 top-end office system, and I'll come to that a little later. And of course, if budget is not the option, then of course you have 3D systems, which are the Ingenuity and the Zeiss Artivo 800. Coming to the viewing systems. Viewing systems, they are basically two types. They can be either a contact viewing system or a non-contact viewing system. In contact viewing systems, further, there are direct vitrectomy lenses and there are indirect vitrectomy lenses. In direct vitrectomy lenses, they form basically an erect image, and they come with a combination of prisms and flat lenses along with a ring, which is called the Lander's vitrectomy system. You have to suture the rings, or even there are non-suturable rings available now, and you have to use different rings to see different parts of the retina. It's quite a cumbersome procedure working with this. I've seen this happening, but personally I'm not a big fan of it. Indirect vitrectomy lenses are, this is the catalog from VOC. So they're wide range of wide field lenses and central retinal lenses. I'll just come to them one by one. Of course, with the indirect lenses and the indirect viewing systems, you have inverted images, so you'll need an inverters. The Oculus one and the VOC one are popular choices. In wide field lenses, the HRX vitrectomy lens or the Mini Quad XL are the most commonly used, and they give a very wide view for vitrectomy, and you can see up to the aura very comfortably. And of course, there's a Mini Quad previous generation as well, and the DynaView, which is mainly used for pediatric surgeries. Central retinal and the supermacula are mainly basically both used for macular work and up to the mid periphery. The central retina gives a slightly wider view. Non-contact viewing systems are the most popular ones these days, and I think most of us newer generation people are trained on these. The popular options are the Zeiss Resight, Oculus Biome, VOC Merlin, Topcon Office, Hark Street, iBoss, and Leica RUV. So Zeiss happens to be one of the most popular amongst the younger generation, probably because of the ease of use. It comes in two models, which is the 500 and the 700. The 500 is the manual one and the 700 is the automatic one. The only downside is it can't be used with any other microscope. It's only used with Zeiss microscopes. It comes with basically two lenses. One is the yellow lens, which is the wide field lens, and the green lens, which is the macular lens. It's a 60 diopter lens. Oculus is one of my favorites because of sheerly the ease of use and the quality it offers. The most favorite part here is the golden lens which they offer, which is actually a combination of a macular plus a wide field. And you can do all maneuvers with this. Of course, they have the other range of a wide field 120 lens with a midfields 90 and a macula 6 and a small pediatric lens as well. Merlin system is very similar to the Oculus system. It offers a wide field lens, a mid field lens, and a small lens for pediatric surgeries. The Topcon, this is what I have. It offers a wide range of lenses from 40 high macular lenses to 80 midfield lenses and 120, and each offered in a small and a big variant. But personally, I only use two lenses, which is the 120 wide field lens and the 80. And most of the maneuvers, even ILM peeling, everything can be done very comfortably with the 80 lens. So these I've kept together, and they're a little different. Why so? Because IBOS, Hark Street IBOS and the Leica RUV do not require an inverter. And they have an inbuilt inverter, and the lenses are slightly different. And again, they also come with a wide field and a midfield or a macular 90 lens. Coming to the most important and the last part of this, vitrectomy machines. Vitrectomy machines can range from very little to the sky is the limit. And in Indian budget options, they are good machines. And of course, if you're looking for an imported, if you're looking for the idea is if you're looking for a very basic setup and you're doing mainly a cataract practice, you want to do simple VR procedures, I guess an Indian machine is good. And we've used the Reticare for quite a few years. And Appa saw me recently come up with the Galaxy robot, which I've heard good things about. But then again, the pros of these machines are they are cheaper, yes, and they get the job done. The running cost is also less. But the cons are they're quite less efficient when compared to the high-end machines. They're cumbersome to use, and they have slightly inferior quality and functioning. And if you're looking for a pure VR setup and you want to do full-fledged VR work, I would really recommend a high-end imported machine. And the most popular options are the Alcon Constellation, the Bosch & Lomb Stellaris, and the Dork EVA. There are other options as well, which is the Goider Megatron, Earthly OS4, Opticon Revolution. Nishat has that, and I think he can give you a little insight on that. The pros of these machines are their excellent quality and functioning, very efficient, easy to use. But of course, at the end of the day, it boils down to the pocket, and they're expensive. So I personally have the Alcon with the PurePoint laser. So I'm going to be just mentioning a few key favorites of what I like about this machine. First of all, it has excellent vitrectomy cutters with extremely predictable and controlled cutting and suction. Their trocar cannula systems are excellent. The light source, personally having used Reticare for so many years, there is a huge difference between what the light in the Reticare is and what the Constellation offers. And even the chandelier is a beautiful accessory here. I love the IOP control functions, how you can steadily work on a certain IOP, say 30 millimeters, and with just a press of a foot switch button, you can go up to 60. It's very useful in these PDR surgeries to control the bleeds and wherever you would like to play around. It has a very good stability. And they constantly keep advancing their cutters, and they have machine upgrades. And their service is excellent. The person will keep coming and upgrading a machine. For instance, they've had the 10K cutter. The 20K has been going around in research, but they're going to launch that as well. And I personally love the beveled cutter for the PDR surgeries. And another added advantage is it has an excellent phaco. You get the infinity handpiece in this. And I personally, being a retina plus I do cataract as well. I do all my cataracts on this, and I love doing cataract on Constellation. And of course, the instruments with the Grishaber part are also excellent. And the PurePoint laser here offers great quality. The curved laser probes are just excellent. And with one hand, you can do almost 70 to 80% of your laser. So this is what don't mind the wires everywhere. This is what my surgical station looks like. So on the left side, you can see there's a GA workstation with the pulse ox. The OMS 800 is there and the foot switches are down underneath. And you can see the biome part, which is the office system, which is attached there. The Constellation on the right side with the PurePoint and the surgical tray. And I record most of my surgeries. So we have two identical systems of the exact same thing, because we have more than one surgeons. This is what it looks like when I'm operating. There are two trays which are prepared. One is for the instruments that I need continuously, and the other ones are where I need some backup instruments, say dyes, lenses, and other things. And usually I have a fellow who's assisting me and who's learning from the side scope, and a OR sister that is usually assisting me. So with that, I'd like to conclude and thank you.
Thanks, Veer. That was a comprehensive